All right, today we are talking about something that affects millions and millions of people, but a lot of us don't really know what it is. We're going to break down chronic obstructive pulmonary disease, or COPD. We'll get into what it is, what's actually happening inside your lungs, and maybe most importantly, what you can do about it.
So have you ever thought about that nagging cough that just doesn't go away? Or that feeling of being completely winded after just walking up a flight of stairs? You might brush it off, but those things can be your body's way of telling you there's a serious battle going on inside. Okay, let's get right into it. First things first, what in the world is COPD? Yeah, the name sounds kinda complicated, but the idea behind it is actually pretty straightforward. And I want you to remember this from the get-go. Even though it's serious, it is often preventable and definitely treatable.
So at its very core, COPD is all about one main problem. You can't get air out of your lungs easily. This is what doctors call airflow limitation. And the key words here are chronic, meaning it's a long-term thing, and that the damage, well, it isn't really reversible. It makes breathing harder as time goes on.
Now here's something really important to get. COPD isn't just one disease. It's more of an umbrella term for two major conditions that are usually happening at the same time. You've got chronic bronchitis, which is basically inflammation and a whole lot of mucus clogging up the pipes. And then you have emphysema, which is when the tiny air sacs at the end of those pipes get damaged. It's this one-two punch that really defines COPD.
So to really wrap our heads around this, we've got to take a trip inside the lungs. Let's zoom in and see what's happening on a microscopic level, because that's what's causing that breathless feeling.
I want you to think of your airways, the bronchial tubes, as the highways that air uses to travel in and out of your lungs. Well, with chronic bronchitis, these highways get a major traffic jam. They get all inflamed and swollen, which narrows the lanes for the air.
And here's a closer look at that traffic jam. The walls of the highways swell up. Then these little glands that make mucus just go into overdrive, pumping out way too much of it. The end result? A clogged, narrow, restricted highway where it's really tough for air to get through, especially on the way out.
Okay, so let's follow that highway all the way to the end of the road. That's where you find these teeny tiny, delicate air sacs called alveoli. This is where the magic happens, where oxygen gets into your blood. But with emphysema, the other half of COPD, these destinations are literally being destroyed.
Healthy air sacs are like brand new tiny balloons. They stretch easily when you breathe in, and then they just spring right back to push the old air out. Emphysema wrecks the walls of these little balloons. They lose their springiness, they become like old, stretched-out party balloons that can't push the air out anymore.
And this brings us to the central problem in COPD. When you put together the clogged highways from bronchitis and the floppy, damaged air sacs from emphysema, you get this thing called air trapping. Stale, used air literally gets trapped inside your lungs, which means there's less room for fresh air to come in. That is why breathing becomes so difficult.
So this all begs a huge question, right? What in the world is causing all this damage in the first place? Let's take a look at what actually triggers this disease.
Okay, while there are a few things that can contribute, there is one cause that just towers above all the others: tobacco smoke. Smoking is, without a doubt, the #1 cause of COPD. Now, other things can play a role for sure, like long-term exposure to dust at work, air pollution, or even a rare genetic condition. But smoking is the big one.
So, we've talked about the battle happening inside. But how does that show up on the outside? And how can a doctor know for sure that what you're feeling is COPD?
You know, the tricky part is that the signs often creep up on you really slowly. The biggest clue is shortness of breath, what doctors call dyspnea, that gets worse when you're active. That nagging chronic cough is another classic sign, sometimes with mucus, sometimes without. And then there's wheezing, chest tightness, and just feeling wiped out all the time because your body's working so hard just to breathe.
If you have those symptoms, there's one test that's the absolute gold standard for finding out what's going on. It's a really simple breathing test called spirometry.
Okay, don't let the letters and numbers intimidate you. This is actually pretty simple. Spirometry measures two things. First, how much air you can blow out in total. That's the FVC. And second, how much of that air you can get out in the very first second. That's your FEV₁. See, healthy lungs can blast most of the air out right away. But if you can't get at least 70% of your air out in that first second, it's a clear sign that you have a blockage. And that's the telltale sign of COPD.
You know, a lot of people mix up COPD and asthma. And it's easy to see why, but they are fundamentally different. COPD usually shows up later in life and just slowly gets worse.
Asthma can start when you're a kid, and the symptoms can change from day to day. But the single biggest difference is this. With asthma, the airways can open back up with medication. With COPD, that airflow limitation, it's largely permanent.
All right, so getting a diagnosis like this, it can feel like a gut punch. I get that. But this is where the story totally changes. This is where we shift from understanding the problem to taking control. It's all about empowering yourself to live a really full life.
And if there is one single thing, one message you take away from all of this, please let it be this. Nothing, and I mean nothing, is more powerful or more important than quitting smoking. It is the only thing that can truly slow this disease down in its tracks.
So, the fight against COPD isn't just one thing. It's a full-on battle plan. Step 1, obviously, is to stop smoking. After that, there are medications called bronchodilators that help open up those airways. Then there's something called pulmonary rehab, which is amazing. It's like physical therapy for your lungs. And of course, staying up on your vaccinations is absolutely crucial to prevent infections that can make things much worse.
So here's the bottom line. Is there a cure for COPD? No, not right now. But is it manageable? Absolutely 100%. With the right game plan, the right lifestyle changes, people with COPD can control their symptoms, they can stay active, and they can have a fantastic quality of life.
And that really leaves us with one final thought, doesn't it? Knowing what the battle is, that's the first step. The next step is taking action. So whether this is for you or for someone you care about, knowing what's happening on the inside gives you all the power you need to change the story on the outside. So the question is, how are you going to use that knowledge?